Good morning. A lot of great energy in this room this morning. I am thrilled. We have two presenters today to share about the Jamestown Healing Clinic. After a lot of controversy in the Swim community and in Clallam County, the clinic started up in 2021. And then I have in front of me, or I had a newspaper clipping from February 7th, and with a possible expansion of the tribal medical clinics. So with great pleasure, I want to introduce Molly Martin. Molly Martin is the executive director of the Jamestown Healing Clinic and has worked for the tribe for 6 years. She is a nurse practitioner with a doctorate in nursing from Pacific Lutheran University and is originally from Seabeck, Washington. Molly has a background in family medicine and addiction medicine, as well as healthcare leadership, has been able to combine these skills in the development and management of the healing clinic. And our community so benefits from this expertise and experience. Josh McCool is a substance use disorder professional and the director of recovery services at the Jamestown Healing Clinic. Enrolled member of the Confederated Tribes of Grand Ronde, and he came out of Oregon to share with us here. I mean, he lives here now, but he came up to run this program with Molly. He grew up in Washington and moved to the Olympic Peninsula in 2006, got an AA in the addiction studies from Peninsula College, BA in applied psychology from City University of Seattle. His hobbies are raising a 7-year-old son, sports, and cultural practices. So we know you're busy. So without further ado, we'd love to have an update about the Jamestown Healing Clinic.
Thank you all for having us here. I really appreciate it. Are you able to pull up a slide? So usually I have a little slide deck that I follow, so I don't have to look at a screen, but it's sitting at the clinic on my printer. So we're going to wing it a little bit. Josh and I really appreciate the invite of being able to be here. We both have been working at the Healing Clinic since it started in 2021. And prior to that, Josh worked at Clallam Counseling, and I worked for the Jamestown Family Health Clinic, also in Swim. The Healing Clinic is a unique clinic. We're a SAMHSA certified opiate treatment program, which means that we have a special certification from SAMHSA to be able to prescribe certain medicines and do certain treatments that other clinics may not be able to do. We are owned by the Jamestown Clallam tribe, but we are here to serve any members of the community, tribal or the rest of the community, for people who live in Clallam or Jefferson County. We also accept most major insurance, including Medicaid. So we try to make sure that there are no barriers for people coming for services with us. And we are open 6 days a week in Swim. We are located back behind Costco. You would never know that we were there unless you actually drove back there to see us. And we have some unique hours. We're open from 6 a.m. till 2 p.m. So your guys' meeting is like right up our alley for being awake nice and early. And one of the reasons for that is when people are seeking treatment for substance abuse, we need to offer hours that are outside of the workday. So people can come to us and receive all of their services before they have to go to work or school or other. All right. We get a lot, well, I'll say that initially there were a lot of questions as to why a clinic like this was even necessary. But unfortunately in our community and across the nation, opiate use disorder, so opiate addiction, is a rapidly growing problem. And it's a problem that is very significant. Opiates are things like heroin, fentanyl, and then pain pills like morphine, oxycodone, things like that. But predominantly in our community, illicit fentanyl is the main drug that contributes to opiate use disorder. About 95% of our patients who we see test positive for fentanyl on intake and report that they have been using for over a year, and with many having some type of opiate use going back to and between 2021 and 2023, Clallam County saw a significant spike in their opiate overdose death rates. And in 2022, we were the third highest overdose death rate per capita in the state. And unfortunately, we raised to being second in the state in 2023, which shows that this is just a continuing issue in our community. But there are things that we can do about it, and programs like our treatment service are able to help. Very briefly, we're happy to answer more questions about this after the presentation. We always get lots of questions about fentanyl and other drugs that people may be misusing. Fentanyl, though, in a nutshell, is incredibly dangerous. Even a small amount could potentially kill somebody, especially people who are not, their body is not used to receiving opiates. It's at least 50 times more powerful than heroin and 100 times more powerful than morphine. And we are seeing newer, stronger versions of fentanyl hitting our street right now with what are called fentanylogs that are theoretically up to 1,000 times more. And it is really scary stuff. And our theory is the faster we can get people into treatment, the sooner we can start reducing their exposure to the substances that they're currently using, but also the sooner we can start reducing the demand in the community for these illicit drugs. And, you know, I would just love it if we put every drug in business by giving treatment. But unfortunately, what we're seeing with the substance use rates, it doesn't seem that's it. All right, let's go to the next slide. At the Healing Clinic, all of our treatment is voluntary, and we take a very low barriers approach to seeing people for services. The majority of our services are on a walk-in basis. We don't run a wait list because there's no reason to wait. When somebody is ready to seek treatment, we're ready to see them. They can walk in anytime when we're open, and we will start the process of getting them an intake, which typically is about a 3-hour-long process. And is very heavily regulated on the state and federal side for all the things that we need to do. That includes things like a full counseling assessment with somebody like Josh, which can take a few hours. We do blood and urine testing. They have a medical exam with somebody like me, and then they get an order for their first dose of medication, which is something like methadone or buprenorphine. So we generally try to dose our patients the first day that they need services, because the sooner they get a dose of medication, the sooner you can start relieving their withdrawal symptoms and cravings to go to bed. And also the sooner you can start working them up to a therapy replacement. We also just distribute naloxone, which is known as Narcan, to all of our patients. And patients are able to spend any time to see us and get more of that. For those who don't know, Narcan is an overdose reversal medication that can be used to rapidly reverse. And our patients receive that when they and we offer a variety of other wraparound services to help their sobriety and recovery. We try to be as much of a one-stop shop as possible for the folks who are coming to us. All too often, recovery becomes something where you go to one place for counseling, you go to one place for your medication, you have to go somewhere else to see the dentist, and then in the midst of all that, you have to figure out who's going to watch your kids and where you're going to get gas money and stuff like that. And we do it all under one roof so that people can start and finish all of their services with us and not have to go out. All right, slide. I won't touch all too much on this, but if you have more questions about the medications that we use to treat people for opiate use disorder, please just come and talk to me afterwards. Essentially, all of the medications that we prescribe, though, are FDA approved and generally given in a daily dosing model where we watch them take their doses each day. The majority of medication that we prescribe is methadone. And that's not because methadone is superior to any of the other meds out there, but it's because methadone is unique to the opiate treatment program. And other clinics that aren't in the opiate treatment program can prescribe all the other medications. But methadone has to be prescribed in monitored OTT. So by the time a patient has reached us, usually they've tried the other medication setting, and now they need methadone and the intensive services to be able to. One of the amazing things about these meds is how quickly they can turn from different. There are lots of excellent studies out there that support that as people stabilize on medications, they rapidly see an improvement in their overall life stability. They have a reduction in crime. They have an improvement in their mental health, regardless of the other mental health treatment that they may or may not be getting. They also have a reduced risk of overdose by 60 to 80%, which is just phenomenal. And that's even if they haven't completely stopped using other substances yet. So we look at every dose of medication that we give as the day that they are there, the day that they're engaged with us, that is a day that they have the reduced risk of having an overdose. And the more we can get people coming back to see us, the more that overdose. And then, of course, all medications are best combined with counseling as well as other sobriety support services. I'm sure that if people were around this community in, say, 2020, 2021, you heard a lot of myths about medications for opiate use disorder and about the services that we were intending to provide. I can just assure you that the bad things are definitely. People like Josh and I wouldn't be working in this field if those were true. So first of all, medications for opiate use disorder it's not just replacing one bad drug from another. Our medications help people stabilize and help them feel normal. Our goal isn't for people to feel high or impaired. Our goal is to improve their function to where they say they feel normal. They feel like they felt before they stopped using. And that's what the majority of our patients report. And medications for opiate use disorder also work far better than if somebody tries to quit cold turkey. If somebody tries to quit using opiates cold turkey, their chance of relapse within the first 6 months is 90%. Some data says it's even higher than that. And the unfortunate thing is that when somebody has a return to use of opiates, their body's no longer used to them, and so their chance of overdose just skyrockets. So if we can help keep them safe by providing medications, that is clearly the best way to go, not only for the individual, but for their family. There is no timeline for how long somebody can be on medications. There used to be this thought that you only use them for detoxification, and then 6 months down the road they should not be on any meds. That is not true. The longer somebody is on medication, the better they tend to do. We don't pressure people to stay on meds. If they want to taper off, we will work with them with that and create an individualized treatment plan. But if somebody feels like these meds are helping them long term, we don't want them to stop taking them until they're ready. Because even if they've been on them a few years and they don't feel like they're ready to come off, if they're pressured to taper, their chance of relapse goes up very, very quickly. And there also is no one-size-fits-all treatment plan for patients. You'll see these things published online that talk about, after X number of months, somebody should be here or they should be doing this, and this. And that's just not true. Every person is an individual. Every person started using for a unique reason and has a unique background and lived experience, and we have to create individual treatment plans for them based on that. We can't just follow a formula and say this person's going to get this amount of medicine, this person's counseling, and they're going to get better, because we don't know that. Everybody needs that individualized level of care. Yeah. And then lastly, opiate use disorder does not discriminate. You cannot look at somebody and say, yes, you have an opiate problem, or no, you don't have an opiate problem just by judging their appearance. And I think that was a common myth that some of us may have heard about the types of patients that we could potentially be seeing. And that's just not true. We also are not bringing people in from out of the community just for opiate treatment. We do provide transportation through our clinic via multiple transportation vans each day, but we only go to Clallam and Jefferson counties. We go as far out as Joyce, and then we actually go in the opposite direction as far out as the Bridge. And we are running routes all day to get people treatment. But there is no bringing people in from out of our to receive services because there's people here who need the treatment and others who also. Okay. Daily dosing. So daily dosing basically just means that our patients receive an observed dose of medication every day with us, except for Sundays when they get a take-home dose of medicine for the day that we're closed, and then they resume dosing meds with us that Monday. So we take a very safe approach to our medication prescribing, and all of our medication orders are ordered by medical providers like me, and we make sure that every dose is individualized by the patient and observed by nurses afterwards to ensure that the patient is safe to be able to come back to day. See, and then after somebody is sober for 3 months from all illicit substances, alcohol, any other potential substances of abuse, they are slowly able to start earning additional take-home doses of medication, because we don't want people, tied to us forever, coming in every single day. As they get their life back together, they should be able to have more freedom in controlling their medicine. But we do it in a very careful and controlled way, so that we ensure that not only are we keeping them safe, but that we're keeping them safe by us. All right. There you go.
So we have SUD counseling. We do individual sessions with people. We have outpatient, just like counseling, so the girls in town. We do IOP meeting groups. A lot of the common topics. We do education and try to help them build skills for living in recovery, coping with triggers. We deal with PTSD, anxiety, and depression. We have a specific men's and women's group. Talk about healthy lifestyles, spiritual health, income management, healthy relationships, relapse prevention, parenting and recovery. And we also have the drum group. We get into some cultural stuff. And there are recovery activities. We got drumming. My drum right over there. I painted that. We got art therapy, gardening. We got a thing in the morning called Coffee with Counselors. We have a peer support who sits in there, and patients are able to go in there, drink coffee, have a space where they can just be and not have to sit down like with counselors and dive deep about skills and treatment plans. Just be able to be and have coffee. Every Tuesday and Friday we provide breakfast so that they can have that space. We have parenting skills. We have a parenting group that one of our counselors is substance use disorders, so it mixes both and how to deal with both. We got peer support, crafts, and drop-in activities.
I'm going to add in one extra thing that Josh didn't say about why we have all these activities. And for opiate treatment programs, they, on a federal level, they have very specific rules about how long patients can be at your facility after all of their treatment or services have concluded for the day. And the rule is 15 minutes. After somebody's there 15 minutes, if they aren't waiting for anything else service or loitering, But we have air conditioning in the summer, we're warm in the winter, we have food, and we have friendly people, and we're a sober environment. And why would we want to make people leave that if they aren't ready to? So we started creating group after group and activity after activity based on patient feedback and what our counselors were noticing that people would be interested in, so that we could give people a longer opportunity to be with us every day. A lot of these things are just the tribe donates all the materials and things for us to do. People are paying for, and it's just so that we can try to help people feel like there's a place where they're welcome. And I also look at it as like, you know, they're here with us. We're able to keep an eye on them. And the longer people can see that positive influence from all of our counselors and staff, the more likely they are to be able to facilitate recovery. Some of our other wraparound services are, we have primary care services. So just like you go to your primary care provider for your blood pressure and diabetes, things like that, we provide that service to our patients on site if they want to have us do that. We also offer preventative care and hepatitis C treatment on site. So we are able to give patients their hepatitis C medications on site with their daily dosing of their other medicines. And hep C treatment is amazing these days. 8 weeks of hepatitis C treatment for most patients provides a cure for the disease. And so not only can we treat their substance use disorder, but we can generally cure them from hepatitis C in the span of their treatment with us. We have, in the last year and a half, we have at least 15 people who are cured of we also offer behavioral health services on site. So mental health counseling and psychiatry services are available every week for patients. And both of our mental health counselors are dual licensed substance use counselors. So they can see patients for both issues rather than a patient having to go to one clinic for mental health and substance use. And we have a nurse case manager as well who helps all of our patients with complex medical issues kind of sit down and figure out what their treatment plan is going to look like from the medical side. That the nurse case manager typically will, she will meet with patients sometimes once a week to try to help them get all of their health needs figured out. Lots of patients haven't had medical care for 10 plus years, and you know they may have been supposed to be seeing a cardiologist or an orthopedist or somebody or numerous specialists, and haven't had that opportunity. And she helps and sits down and gets all their referrals in place, gets their appointments scheduled, and even figures out how they're going to get transportation. All right, next slide. We also offer dental care on site, which is absolutely amazing. Dental care for people is few and far between in our community, and most of our patients have not seen a dentist in 10+ years. They have abscesses, they have teeth that need to be removed. And for a lot of them, at least some of their substance use results in trying to self-medicate dental pain that they weren't able to address in other ways. So once we can get them out of pain and discomfort, often for recovery as well. And then we also offer transportation to our clinic, as well as people can bring their kids and watch them. And I think this is one of our last slides, but a week and a half ago, we expanded our treatment to Western Clallam County. We have a mobile treatment unit that is a really tricked out RV that is now parked at the Clallam Bay Fire Station 5 days a week. We offer on-site dosing, counseling, and medical care, just like we do at the Healing Clinic. And patients who are seeing us in Clallam Bay also have access to all the services that we have in Sweden if they were to want to come in and get care there, like they can see the dentist. They can come and see one of the psychiatry slides. And we're hopeful to continue to expand these treatment options. So far, I've already worked on the mobile unit, and so far it's doing really well. We've had new patients every single day that we've been out there. And it's a really great way for expanding resources to more rural regions of our. Okay. Next slide. Last but not least, I'll end this with, we started in July 2022, but we already have about 160 patients with us and 54 staff members, which I just want to highlight because 160 patients to 54 staff doesn't sound like a lot, but caring for people who have these complex issues takes a lot of staff effort and time to be able to do. And that's one of the reasons why clinics like this are successful, is because we have to up staff to be able to accommodate the needs of each patient who we see. The majority of our patients do live in Fallon County. We have about 90% Fallon and 10% Jefferson. And the average age of our patient is 40 years old, although the majority of them started using late teens or early. So this is not a new problem for our community, but we are. I have referral information for anybody who wants it, sitting over here at the table. I will just end it with, we are continuing to expand to try to meet the needs of our patients in the community. And there's lots more good stuff coming. Okay. And Josh and I will hang back if you guys have any questions. So fun.